New Jersey Township High School, athletes are lucky enough to have dedicated coaches and trainers who are concerned about their health and safety. The IHSA, or Illinois High School Association, is an organization that governs participation in athletics and interscholastic activities. One of the board of directors' jobs is to create and enforce the Rules and Guidelines Handbook for athletics in Illinois. The only rules for injury are the physical and concussion regulations. If only 14% of injuries occur to the head, that means 96% happen somewhere else in the body. Why are there no regulations on how to handle those injuries? At New Jersey Township High School, after recovering from an injury, an athlete must go see the athletic trainer and be cleared in order to return to their sport. What's the process that athletes have to go through to get cleared?
Well, there's many things that go into it. Mm-hmm. First of all, we actually do have a guideline, a rule, if you want to say, for our athletes. That there's 5 people that all got to say that an athlete can play. Oh, okay. So any one of the 5 say no, that athlete doesn't play. First of all, it's the athlete, right? They got to be willing to play. 2, the parents, 3, the coach, 4, the athletic trainer, and 5, the physician.
The rule Dale just talked about is unique to New Trier. The administration and athletic department felt the need to create an additional rule because the IHSA does not have one concerning injured athletes returning to their sport. Unfortunately, the only rule the IHSA enforces and that applies to general injury is a required physical, which every athlete must have completed by their physician by the start of the sport date.
So can you talk about a little bit what's on the physical and how you evaluate the student on the physical?
Well, if there is an acute injury, something going on, great, that's really helpful. But when I ask, has there been any injuries over the last year? The athletes normally don't say, oh yeah, my shoulder hurts, especially when I do this sport. So they kind of just focus on broken bones or things that are bothering them at the moment.
The IHSA's primary goal is to keep athletes safe, but clearly the physical isn't cutting it. Dr. Franzia said that athletes don't usually bother mentioning the little stuff like muscular or ligament injuries, but more focus on the big events like broken bones. If even athletes' doctors are unaware of aches and pains in their patients, then the doctor can't restrict their play or provide help. The IHSA rulebook does not adequately protect athletes from their own determination. The rules need to be adjusted so that injured athletes have a procedure to go through so that they can return to their sport. All athletes should be forced to check in or be cleared 3 separate times during their season in order to prevent and be able to assess injuries to help athletes maintain a healthy lifestyle. Athletic trainers are there to help you. They always provide helpful tips for staying strong and improving your personal fitness. So why is it that athletes are so hesitant to go see the trainers?
I think that some athletes don't come in at all when they're injured for fear of being put out on the bench. Do you think the fear is just that, I'm going to be cut from the varsity team, I won't get my playing time?
Well, I think that's it. I think a lot of times they fear the playing time. They fear that, people are going to think I'm soft. I can't tell them. But again, and I will tell kids, my goal is not to pull them. My goal is to actually keep them on the bench, keep them playing, keep them on the field. Because oftentimes there's many injuries that I'm willing to push, and I even tell them I'm willing to push the injury as long as you have full range of motion, full strength, and you can do your job on the field or court.
Injuries such as tendinitis and pulled muscles can't always be visible from the naked eye, leaving the athlete responsible for getting the help. Many athletes push through the pain for fear of being cut or benched after months of hard work. What athletes don't realize is that the trainers are there to keep you on the field, not take you out. If the IHSA required athletes to go see their high school athletic trainers, athletes could strengthen their bodies and learn how to prevent or treat their injury with ease.
Everyone, but it's important. A lot of people poo-poo physical therapy. That is so important because you're strengthening the other muscles in order not to overuse the ones that cause the injury in the first place.
And so the students that you do send to the physical therapist, when you see them later, say for the next physical, have they ever talked about feeling of improvement, or can you see the improvement?
Absolutely, yeah. But it's just a matter of being proactively, doing the exercises they were taught before the season starts and continuing with the stretching. And I don't think a lot of adolescents or athletes do that. They kind of.
As Dr. Franzia said, physical therapy is essential to the recovery of an athlete's injury. Dale Grooms and his staff have made it a priority to do rehab in school so that they can monitor athletes' progress.
When I first came, the one athletic trainer that I am going to reference, I'm not saying a name, that individual didn't want to do rehab in school, didn't want to do rehab. And the quote was, they told me they didn't want to ruin their collegiate experience in case they went to go play. I thought that was kind of silly. I wanted our kids to be able to rehab here, and then this way keep them healthy and safe throughout their career. Yes. So we reduced the recovery time, but we also tried to get them back stronger than if they just sat on a bench for like 3 weeks.
Although it is an athlete's own responsibility to take care of injuries, their coaches play a large role in keeping athletes safe as well. Unfortunately, there are a lot of coaches who are so focused on winning that they put their athletes' health on the line.
Would you say coaches play a role in athletes not coming in when they're injured?
There was a time where we had coaches trying to, and I know of other schools, where coaches tell their athletes, don't go see the athletic trainer.
Coaches are in a position of power over their athletes. As role models, we look up to them and always adhere to their advice. If the IHSA had a regulation mandating that all athletes had to visit their athletic trainers, coaches would no longer have the power of saying no to seeing a trainer. By taking away that power, trainers could be kept more involved and in the loop with their athletes.
Do you think that they might be feeling that joint pain if they've worn away their cartilage enough later in life?
Absolutely, yeah. A lot of injuries later on in life, arthritis specifically, that cause, again, knee injuries, knee replacements, hip, ankle, all start with your growing body and what you do athletically.
You know, with some of these people who sprain their knees, or even soccer sprain their knees, these people are going to be more arthritic later in life. But, you know, that's basketball, that's every major hard cutting sport. You know, but you think about like cross countries and all that, there's some wear and tear on their joints as well. So there's a possibility of that aggravating their, things down the road.
So would you say the work that you do with the athletes who do come in, does it reduce maybe those aches and pains that they'll feel later in life?
That's our goal. And that's when I'm looking at someone and we're doing evaluation and trying to determine whether they can go or not. It is something where I will actually quote, and I'll say, I'm thinking about not just you now, but I am thinking about you 20 years down the road.
Athletes who don't get help for injuries are not only hurting themselves then, but also later in life. From not letting injuries heal, many ex-high school athletes have reported early onset osteoarthritis and arthritis as early as 30 years old. Athletes are also reported to have a high percentage need for hip, knee, and shoulder replacements from worn-away cartilage. By simply making athletes go see athletic trainers, we can reduce the need for joint replacements and reduce osteoarthritis. The IHSA is responsible for 28 sports teams in 760 high schools across Illinois. With thousands of athletes abiding by the IHSA's rules, the board of directors should amend the policy's handbook for a rule that would protect athletes against injury. An athlete's determination to play through the pain can become very serious as the injury begins to worsen. Adding a rule that would mandate that every athlete must visit their athletic trainer 3 times during their season would only have positive outcomes. By visiting the trainers, athletes can learn more about how to take care of their bodies, and the trainers can begin to do rehab with athletes who are injured. Including this rule would create stronger athletes, reduce injury, and promote athletic training programs across high schools in Illinois.